All right, thank you, Alonzo, and welcome everybody. We're so excited to be here to talk about this poll that's been a long time coming. I'm going to just spend a couple of minutes to set the stage and provide some context for the poll, and then Bob will highlight some of the poll results, and Joe will present some stories that really bring these numbers to life. So as Alonzo said, this poll is one in a long-running series of public opinion polls that RWJF has been doing with Harvard and NPR over the last several years. We did a series on discrimination in America that you may have heard on NPR back in 2017, and in that poll we looked at the experiences of discrimination among different groups in the U.S., including African Americans, Latinos, Asians, Native Americans. We've also done surveys on topics such as patients' perspectives on healthcare, workplace and health, childcare, stress, and the social determinants, and many others. We use this public opinion survey work to really provide the initial seed for conversations like the one we're having here today. And we aim to shed light on the lived experience of different groups of people to further understanding and to find common ground. And we link the results of these polls to other programmatic work and research that we at the Foundation are doing, as well as other people around the country are doing. This series, Life in Rural America, is a two-part series because we had so much we wanted to learn about what was going on with people living in rural America that we just couldn't fit it all into one survey. So the purpose of the survey was to really understand people living in rural places in the U.S. and how they're thinking about and experiencing opportunities for economic advancement, health and well-being, and how they're dealing with the challenges that they face. We believe the results of these surveys are unique in their focus.
I usually blame the Russians.
So we believe the results of these surveys are unique in their focus on individuals' personal experiences in their rural communities across a range of areas of life. The findings from this poll will provide us with important evidence on how realities look on the ground across rural America and give us an opportunity to start a grounded conversation about health, well-being, and equity in rural America. So I'll talk about a little bit of other survey work that we're doing in rural America at the end of this session. And now I'll turn it over to Bob to present some findings from the poll.
Do we have a clicker somewhere?
It's on podium.
Oh. Hi, Bob Blendon. Before I show slides, I want to take a few minutes just to talk about the overview of this. I discovered that audiences can get mesmerized by this data and they forget why we're here. So what is unique about this poll and its partnership with NPR is we're giving voices to people to talk about their lives. This is not an expert's view of what's going on in rural America. We allowed people in design questions to talk about their life experiences. So I want to highlight, and then NPR, which Joe will talk about, actually takes real live people talking about their lives and puts them on the air. So you actually relate to people's statements about themselves, and then you listen to someone work their way through the problems. So that's what it's really about. And so quickly on the high points here, we asked people in their own words, what are the biggest problems in your community? And this was a surprise and made a lot of news in that people listed opioid and drug abuse and the economy in their own words. This is not a list or anything for that. These were not the top problems facing the country when you ask Americans. So there was a response here that does not correspond nationally. And then you want to follow up and say, is this something I read about or is this actually familiar in your lives? And half the people we surveyed knew somebody suffering with the drug abuse opioid problem. So it's not just a news phenomena. On the economy side, 55% were asking about the place they live, say the economy is fair or poor, and that is much higher than at the same time when you ask people about the U.S. economy for that across the country. So we tried to find some way simply to ask people, what does this really mean? What this 55% number? And we gave them a simple question, could you pay an unexpected bill of $1,000? for it. And the reason why I picked that is that tends to be averages for medical bills, house bills, or car bills, auto bills. That's what it is. And can you pay them, and all these things about payday loans and everything all come out people can't pay this $1,000. And we found half of people in rural America couldn't pay that $1,000 for it. And it says a lot about the rest of their lives. And then we just asked about routine expenses. Let's not get very in depth here. And that again is medical bills, paying your rent and housing and food. And 40% were struggling on the routine bills. It's easier when you tweet for that. And then we're in an era where many of you have played a leadership role in implementing all these new healthcare programs. Therefore, we thought we asked people about getting healthcare, it would have been a relatively low number. And 1 in 4 people reported in the last few years they couldn't get healthcare they needed. And the largest reasons were a combination of I just couldn't afford it, or which couldn't answer is a lot of people have insurance and the providers won't take it. For it. And then it's not available. But the financial side of why I can't get care remain very, very real in people's lives, even though in the aggregate all this progress has been made. We asked people about access to high-speed internet, and 1 in 4 had a problem. And just briefly, why it matters. And so it turns out that we are in an economy where people can work off-site, thousands of miles, hundreds of miles away, if you have high-speed internet. And so 1 in 4 don't. And then the second thing is more and more people know they need skills and they want to get on internet courses. I can't do it if I have it. And the third is, we'll discuss this later, but there's a revolution going on. We can deliver pieces of medicine over the internet that we never could do before. So these people are out of that technology revolution. And so it is a serious problem. And we asked about homelessness in the community, and 1/3 of communities, in fact, reported a problem, again, a very large size. So now we can look at the data, and I'll do it very quickly, but the takeaways. So here it is. This is their own words. What are the top problems? And as you can see in Appalachia, where we're sitting, in fact, the greatest concerns about experiences with drug and opioids are in those communities, but it's overwhelming in rural areas. And I need to emphasize this. Year after year, people like me ask polls, and what's the most serious problem never leads to a health problem. And so this is extraordinarily unique. You ask a separate thing about health over here, but when you ask about the problems in your community, to have an opioid at the top is very, very unusual. And you could see it's a serious problem. You can see that half of people know somebody. On the economy, you can see that you have 55% rating fair and poor. And as I said, until we had the $1,000 question, what does that really mean? That means that half of people can't pay that $1,000. And again, we're talking about medical, car bills, house bills. We're not up in some stratosphere here. We're really in things. And here is the 40% who just can't pay routine expenses for that. Here is the healthcare issue. And again, it's surprising because if you sit at national meetings, there has been enormous progress in healthcare in recent years, and there absolutely has. But there are 1 in 4 who just are having problems getting it, and a number are tied to financial reasons. And so the other issues that showed up were homelessness, suicide, of which everybody in this community is quite aware. The U.S. is the only democracy where suicide rates are rising, and they are rising dramatically higher in rural America. So, and people are aware that this is going on, and the high-speed internet. For many of you, this may not be a surprise finding, but it is to many people nationally. Rural communities pride themselves often in surveys that we can solve these problems ourselves. We are people who can get our own problems. We're very proud of our communities and everything else. And in this case, we asked if you needed outside help, and half of people said, yes, we need to have. And so they're mostly talking about the economy and opioids. So there are a lot of other issues at home, I'm sure, that they think they can cope with, but those two, they really do. And then we asked from whom, and rural America in the polling world is not known as the government-friendly community for that. So we were quite surprised that of people who thought they needed outside help, they identified it would have to be from some level of government. State is the more dominant. And I want to be very careful here because a number of people have talked to me about this, that this does not mean that people who live in rural America trust their state governments. It's only that they see the need for outside investments here that cannot come locally. And so let me just close with, we asked people, gave them a whole list from a series of commissions that have been done on the future of rural America, and asked people to prioritize what they thought needed to be done. And so what people recognized on the economic side in particular, somebody has to invest in developing a new structure for jobs. But also I want to make this point because it relates to the internet and others. People are deeply concerned that young people and adults need skills they don't have. And so what those skills are, we couldn't get. But it's very important to understand that people are trying to say to us, there's a skill issue here. I need things in the future, and my kids need things that'll make me function in this very difficult economy. And anything that gets that done is really important. For that, we had a little difficulty. People aren't sure what to do about the opioid issue. So when we asked about solving health problems, it didn't come out with 5 things to do about opioids. They're not sure what they can do. What they are sure is that they need outside help here. These are not easy issues to deal by yourself. So this summarizes not us, it summarizes people's views who wanted others to know about their lives and what is on their minds. And this is where we are.
Thank you. Joe?
Yep.
Thank you, Bob.
Well, good morning. I was asked by Carolyn today to talk a little bit about how NPR uses the polls that we do with the Foundation and Harvard and how those become stories. And as you heard earlier from Bob saying, we really try to bring out the voices of people who are affected by various issues. One of the great things about this polling series, it's not so much an opinion poll, but a poll of people's actual experiences. And because of that, people's experiences don't change over time. So that gives us the luxury as reporters, as journalists, to go out and report more deeply on the findings that we find in these polls. So typically we can take a poll and do a series of stories that go on from, anywhere from a 6-part series to 12 or more. I think we even did almost 36 stories in the discrimination series. So when Carolyn and Bob and I started talking about how would we approach rural America, we realized there were just so many stories to do out there and so many questions that all of us had that we decided to break it into 2. And this morning, if you happen to turn on your radio or you streamed it somehow, we launched the poll on Morning Edition, and we have a story up on our homepage that have the principal findings of the poll. Let me start just by going over quickly. Most of you are probably familiar with NPR, I would imagine. We have quite a big reach, but I think the numbers sometimes are surprising to people. More than 1,000 stations, terrestrial radio stations, air NPR programs. We now reach about 29 million people. We have 40 million people who come to our website each month, 8 million podcasts weekly that are downloaded, and we reach 98.5% of the geographic area in the U.S. We also have a fairly large overseas audience as well, which is not as easy to measure. A variety of platforms now. We're not just radio. We our internet streaming on desktop, smartphone. Be sure to download the NPR app if you haven't already got it, because that allows you to skip through things, and it gives you access to a lot of different podcasts. We're increasingly programming for smart speakers on Alexa, Google, and Apple, and we're creating short form podcasts. Those probably will be coming to you to a smart speaker near you in the next year or so. Also looking at screens and, of course, podcasts. Then we have a whole digital array of how we get our information out. NPR has about 400 journalists on staff. We have 17 domestic bureaus across the country. Many are in cities, but many are in small places. And these reporters get out in the field and are able to travel a lot. And we have one reporter, Kirk Siegler, who's devoted to rural affairs. And then we also have 17 international bureaus around the world. We're broken into, we're organized around several topic areas, as you can see here. And then we have our main shows. What I was asked to do, as I said, and I'll get to it now, is talk about the stories that we were able to do off the first poll, and then I'll talk a little bit about what we're planning to do on the second poll. And as you see here, the big finding and the big news in the last poll was this astonishing finding of concern over opioids being so high nationally, and of course, particularly here in this area being almost, I can't quite read that, over 40%. We were able to go out in the field and do several stories on opioids. NPR has made coverage of opioids a priority this year, well, not this year, the last several years, and we will continue. And it helps us, NPR, I work on the science desk, and we have always based our health and health policy coverage on the science desk, because we have a strong feeling that stories about people's health should be grounded in data. And here are great data for us to use. These polls just fit very much into the philosophy that we as journalists use in deciding how to cover stories. And what we do is we will take one of these numbers, and we can build several stories off of a number to give it a news hook, so to speak, and get people interested in listening to the rest of the story. We were able to do with Harvard and RWJ a forum at Harvard with a panel of experts, which you can still find online, and I would recommend if you want a deeper discussion of that poll, you can go to, you can find that on our website, on the Harvard and RWJ websites. Some of the stories that we really brought to life, one, I'll start with an infrastructure story. We found, of course, that people in the new poll, and I believe in the last poll, broadband access was a significant concern, but also the economy. 55% of people saying their economy was in their community was only poor or fair. So we went out, Kirk Siegler went to this town in rural Colorado, where he had heard that this couple who had been laid, the coal mine in the town had closed, and there were several hundred people laid off. And this couple decided they would take things on and start their own broadband company. And what we do with these stories, not only do we try to build out the data, we try to find people who have creative solutions to problems. It's not necessarily what's called solutions journalism per se, but we very much are trying to move the conversation forward and give other people who are listening, those millions of people listening, ideas on how they can help solve problems, be they in rural areas or cities or somewhere around the world. So Kirk went out here and found this couple who were laying broadband fiber optic cable and actually have hired quite a few people who were laid off, and the town is starting to turn around. We also were very concerned about the suicide finding that Bob mentioned briefly, that 31% of people knew someone who had committed suicide. Is that the right number? Attempted thought about, right. The other thing that we do is we always run everything we write about the poll past Harvard, and Mary Gorski here has been very helpful in helping keep us accurate, along with Bob. Anyway, so Kirk also found in Grand Junction a big expanse on the western side of the Rockies, a series of suicides in young people, and how that town is tackling the problem, how students had taken it on, and were working to try to prevent more. We went to northern Wisconsin. There's a town just off an Indian reservation in Ashland, Wisconsin, and Bram Sable Smith, one of our upcoming rural reporters, freelancer, who found a doctor who had been recruited to this town. The town had had a huge addiction problem, not just opioids, but meth and alcohol. And they had tried to recruit several doctors to come help. And this doctor came with the condition that they also give him enough resources to tackle both alcohol, meth, and opioids, and all of the underlying social problems that lead to these lead to the addiction crisis. And we also did a couple of stories on the surprising finding that Bob mentioned, that people in rural America want outside help. And we went to Bell, Missouri, a small town that is really in trouble. And we also examined it from several other angles too. But I wanted to play you one of the stories just to illustrate best how we use the poll in building our stories. And this is by Anna Boyko Weirach, a reporter out in rural Washington State. And she found this story. She found this town another creative approach to a problem that wanted to treat the opioid crisis like a natural disaster. And we can take a listen here.
Back when Ty Trinary was the police chief of Stanwood, Washington, population 7,000 people, he thought rural communities like his were immune from the opioid crisis. Until one day, a mother walked through his door.
And basically said, Chief, you have a heroin problem in your community. And I remember thinking, well, it's not possible. This is Stanwood. And heroin is in big cities, with homeless populations. It's not in rural America.
Now they're responding to the opioid epidemic as if it were a natural disaster. The idea grew out of their experience with another tremendous disaster in the county.
This is a major slide here.
In 2014, the town of Oso, Washington, experienced one of the deadliest landslides in American history. 43 people died. Sherry Ireton is the sheriff's director of communications.
It was amazing to see Black Hawk helicopters flying with our helicopter and a fixed wing over the top of that, and all in coordination with each other, all with the same objective, which is life safety.
Coordination, life safety. What if they used that system of everyone working together across government agencies to tackle the opioid epidemic? County leaders took the idea and ran with it. Now, the response to the opioid epidemic is run out of a special emergency operations center, a lot like during the Oso landslide. Every 2 weeks, representatives from across local government meet, people in charge of everything from fire trucks to the dump. The technical name for this group is the Multi-Agency Coordination Group, or MAC Group. It comes straight out of FEMA's emergency response playbook.
610 is completed.
The numbers refer to items on their to-do list. There are 7 big goals, like reduce opioid misuse and reduce damage to the community. Each goal is broken down into smaller pieces, like distributing needle cleanup kits and a project to train school teachers to recognize trauma and addiction. This to-do list is over 100 items long. They make transportation easier for people in drug treatment. They train family members and others in the community on steps to reduce overdoses with medicine. And they actually send teams of police officers and social workers to help addicted homeless people. The new approach is paying off. The teams have helped hundreds find housing and drug treatment. That's just one item in the county.
So that's an example of the creative solutions journalism that we're trying to do here. One thing that Alonzo said in the introduction that struck me is we're here as learners, not leaders. As a journalist, I'm always out listening for new ideas. And the other thing that Alonzo said was that the foundation is trying to build more local and regional capacity for understanding these problems. And what NPR is going down the same track right now too. We have these 400 journalists that I told you about on that one slide. Those are the ones who work at our headquarters in Washington and some places around the world. But public radio has 1,400 other journalists out there at stations, large and small. And what we've begun to do is marshal those resources into regional collaboratives. We're building hub systems where we can gather the stories that happen in rural America just as easily as we gather them in the cities and on the streets of Washington. And it's a very exciting time at NPR that we're building this network. We're starting, the first will launch soon in Texas, where a group of stations will produce their own stories for their own Texas network, but those stories will also bubble up to the network. And I would just close by talking about some of the stories that we're looking at off of the part 2 of this poll, which is very exciting, some exciting results. We definitely are focusing on health access today on All Things Considered. We'll have a story from Kirk Siegler on doctor shortage in a small town, I believe in Nebraska. Struggles with low income of all sorts. The infrastructure we're going to come back to and look at in terms of telehealth and also getting more broadband access. And then we want to take a deeper dive into social isolation and loneliness as it relates to the suicide crisis. And one more thing that I didn't put on this list is I just found out about a couple of stories that I probably will bring in on homelessness and housing quality in some rather rural parts of one part of the country. So that's essentially NPR's role in this project, what we do, and we are so thankful to the Foundation and to Harvard for all of your help over these years, and look forward to this and the next one. Thank you.
Thank you, Joe. So I just want to let everybody know that we'll have some question and answer period after the next panel. So I'm going to wrap this up a little bit with just telling you about a couple of resources that we also have available that did a little bit more the personal experience and values and beliefs. We worked with NORC at the University of Chicago, and I believe Mike Mead from NORC is here today, so you can seek him out and find out more about this. We did a large national survey of adults across the country to create a typology of adults based on their health values and beliefs around personal health, community health, their engagement with health, their views about role of government in health. And because we had such a large national sample, we were able to look at just people living in rural America. And we redid that typology using the same methods and the same questionnaire and just did it in rural America. And that work is available on RWJF's website. We also have on the resource table outside just a 2-pager that describes the 6 or 7 segments that came out of that typology, where we really looked at these different patterns of values and beliefs among adults living in rural America. We also had some of my colleagues at the foundation worked with the small business majority, and I think David Chase is here also from the small business majority. There he is over there. Hi. And they did a really interesting project looking at the experiences of rural small business owners. And that project was a combination of qualitative and quantitative work where they did focus groups with rural small business owners as well as with rural stakeholders And then they did a survey of rural small business owners. And it was very interesting to see how it really highlighted some of the same kinds of experiences and issues that rural small business owners are dealing with that were the same or similar to the kinds of things we found in the first rural poll that we did on NPR. So again, that poll was released, I think, several months ago. And you can find David and find out more about that. So those are just some of the different things that we've been doing around to try and provide resources and more data and understanding of what's going on in rural America. So now we're going to do a little bit of chair shuffling. Bob and Joe are going to stay on the stage. I'm going to invite our next panelists to join me on the stage.